طيب, anemia is very easy and you'll definitely get asked about those in the exam. So anemia in general, it means decrease in the capability of red blood cells to transport oxygen, which is their main function. Their main function is to transport oxygen. So this is a red blood cell. We have many different types of anemia, but if we were going to classify them or group them, we have types of anemia that there is decrease in the red blood cells, and we have types of anemia in which there is abnormality in the hemoglobin, whether it's decreased, whether we have low amount of hemoglobin, or we have abnormal hemoglobin. يعني we do have hemoglobin, but the hemoglobin isn't normal. It can't مثلا carry oxygen. So anemia can be either due to decreased amount of red blood cells or abnormal or decreased amount of hemoglobin. تمام? So first we'll talk about the causes that will lead to decreased amount of red blood cells, and they are very easy. First you have hemorrhagic anemia. Hemorrhagic anemia is when you have bleeding. مثلا, let's say someone got into a car accident and he ruptured or got injured, and a big artery was ruptured and he started bleeding very profusely, and so he will have sudden hemorrhage, which will lead into hemorrhagic anemia. Another type of anemia is hemolytic anemia. Hemolytic anemia. Let's say someone has a malaria. Malaria is a disorder in which there is a parasite. Parasite يعني دودة or a worm. There is a parasite living inside the red blood cells. Our body will try to stop this parasite from growing and to stop this infection by killing the red blood cells. Then the parasite is living inside the red blood cell. So the body will start removing the red blood cells or killing them, destroying the red blood cells. So we will have less red blood cells in our body, and we will have less oxygen transport in our body. This is called hemolytic anemia. It's not necessarily due to malaria, but the main point is you have destruction of the red blood cells due to an infection. Could be bacterial, could be parasitic infection, could be many different things. Another type of anemia is aplastic anemia. Aplastic anemia is when the bone marrow is the site where is red blood cell production. The bone marrow doesn't produce red blood cells anymore. This could happen in cancer or in cancer therapy, because in cancer therapy you're giving the body drugs, so this body will produce less cancer cells, but at the same time this drug will cause the body to produce less normal cells as well. So it could be due to cancer or cancer therapy. Another cause of anemia is pernicious anemia, and they always like to ask about this one in the exam. Pernicious anemia is related to vitamin B12. Vitamin B12 comes from animals when we eat meat, okay? But for vitamin B12 to be absorbed from food into our body, it needs something called an intrinsic factor. This intrinsic factor comes from the stomach. The stomach releases this intrinsic factor. This intrinsic factor, let's say this is the intrinsic factor, then the intrinsic factor will bind to the vitamin B12. Then in our intestines or in our bowel, this vitamin B12 will get absorbed. Vitamin B12 has a role in making DNA. So, and you know, cells have DNA because they have a nucleus. So we need this intrinsic factor to get vitamin B12 to get DNA, or for making synthesis of cells.
Sometimes people have autoimmune disorders in which their immune cells destroy the mucosa of the stomach. So the stomach will not start to release this intrinsic factor. There will be no intrinsic factor. When there is no intrinsic factor, there will be no vitamin B12. Another issue might be in which a patient has a stomach cancer and he went to the hospital and the hospital removed all of his stomach in order to remove the cancer. So there will be no intrinsic factor that will help us to absorb this vitamin B12. Another cause might be a person who is vegan. Vegan are people who are not eating meat, and they will not get vitamin B12. So people that have autoimmune destruction of the stomach is also known as gastric. So autoimmune gastritis, or someone who has a gastrotomy, had a surgery in which they remove the stomach, or someone whom is vegan, they are going to have vitamin B12 deficiency. Most likely they will have vitamin B12 deficiency. Vitamin B12 will lead to an anemia called pernicious anemia. Pernicious anemia is also known as megaloblastic anemia or macrocytic anemia. Macrocytic anemia. Macrocytic anemia means there is large red blood cells, larger than normal. Okay? So all of those lead to less amount of red blood cells in our body. Now let's talk about the things that will lead to less amount of hemoglobins in our body. Not abnormal hemoglobin, less amount of hemoglobin. You have iron deficiency anemia and you have thalassemia. I don't know if my spelling is correct, please make sure. Iron deficiency anemia is very common, and usually it happens when either there's less iron in our diet or there is prolonged bleeding, yani someone who's bleeding over a long period of time. A very famous example, and they always like to bring it in exams, is a woman whom is menstruating. So this woman is losing blood over a long period of time, so she's very likely to develop iron deficiency anemia. Iron deficiency anemia is also known as microcytic anemia. It means that the red blood cells will be smaller than normal. Also, the red blood cells will look pale. So pernicious anemia, which is due to decreased amount of vitamin B12 in our body, will lead to macrocytic anemia, and it leads to less red blood cells in our body. But iron deficiency anemia, in which a woman who is menstruating or someone losing blood over a long period of time, will lead to pale-looking red blood cells, and red blood cells are smaller than normal. The red blood cells will be called microcytic, and the cause of it is less hemoglobin in our body, not less red blood cells in our body. Okay. The epidemiology of thalassemia. Thalassemia is common in areas where malaria is common, and it protects those people from malaria. Why is that? Because we said the malaria, we have a parasite living inside the red blood cell. The parasite needs the red blood cell. But in thalassemia, there will be easy degradation or easy destruction of the red blood cell, so it will affect the way the parasite lives. Thalassemia is common in people of Mediterranean origin, such as Arabs and Asians. So before we continue with thalassemia, let me explain to you one simple thing about hemoglobin. You see, hemoglobin consists of 4 chains: alpha 1, alpha 2, beta 1, beta 2. So in thalassemia, you can have deficiency of either the alpha globin or the beta globin. So it can be classified as alpha thalassemia or beta thalassemia. There will be deficiency, yani
less production of either alpha globin or beta globin. And I suppose this is the iron part of the hemoglobin. Okay, beta globin is usually encoded by a gene located on chromosome 16. This is a chromosome number 16. One gene located on chromosome 16. This is not the exact location of the gene that encodes for beta globin, but just an example to make you understand better. And alpha globin is encoded by two genes located on chromosome 11. Let's say those are the location of the two genes. Because genes tell our body what kind of proteins we should make. So in thalassemia you'll have deletions of the genes. But in our body we have a copy of each gene. So we have two chromosome 16. And we have on each chromosome a gene that will encode for the beta globin. So a normal person will have two genes encoding for the beta globin. Each gene is on chromosome 16, and we have two copies of chromosome 16. And this is chromosome 11. We have two chromosome 11 and two genes on each chromosome. So a normal person will have four genes encoding for alpha globin and two genes encoding for beta globin. Okay? People in Africa usually have deletion in one of those alpha genes. So let's say this alpha gene already doesn't work. So they will be more at risk of developing alpha thalassemia than normal people, because normal people have four genes encoding for alpha globin. But African people, some African people, not all of them, already have one gene not working, so they have three left. It's like they have 3 lives left until they lose the game, but other people have 4. Thalassemia is inherited in autosomal recessive pattern. So let me explain to you. Let's say the mother is R, big R and small r, and the father is big R and small r. This is the mother, and this is the father. We want to know what is the percentage that their children might have thalassemia. So only the small r contains a thalassemia trait, but the big R doesn't. And thalassemia is an autosomal recessive. So if you have big normal R and small thalassemic R, the big normal R will be expressed, and the small normal R, small R that resembles thalassemia won't be expressed. So we can do a table, and I'm just doing this to make you understand. This is the mother's R and R, and this is the father's big R and normal R. Small r stands for thalassemia. Okay? So we want to know how likely their children might have thalassemia. So the possibility that they can either have big R, which is normal. They can have big R and small r. They have the trait, but they don't express thalassemia. Or they can have small r, in which this is big R and small r. Same as this, they have the thalassemia trait, but they don't express thalassemia, they don't have the disease. And small r with small r. Only if they get 2 small r's, they are going to have thalassemia. And the possibility of this is 25%. This is autosomal recessive. If it was autosomal dominant, any of those that had a big R will lead to thalassemia, but it is autosomal recessive, so 25% if both of parents have
trait for thalassemia, their child might have thalassemia. So if a parent has a trait for thalassemia, it's advised for him to take genetic counseling. For medical care, people with mild thalassemia, or they have the trait for thalassemia, they don't require medications or they don't require follow-up, but they should be told that their blood pressure might resemble iron deficiency anemia, and they can be misdiagnosed with iron deficiency anemia, but they don't have iron deficiency anemia. They should avoid the use of iron therapy, empirical iron therapy, and iron deficiency might develop during pregnancy or from chronic bleeding. Counseling is indicated for people with genetic disorders. Those are people for mild thalassemia or traits with thalassemia. For people with severe thalassemia, they require medical treatment, and the medical treatment is we give them iron chelation. This word is very important, iron chelation, and blood transfusion regimen. Complications of thalassemia. In thalassemia, we're going to have more destruction of red blood cells, and we are giving blood transfusions. So when we destroy red blood cells, we're going to release iron in our body, and we're even giving people blood transfusions. So we'll have more destruction of red blood cells and more iron, so we'll have iron overload. Too much iron can cause damage to the heart and damage to the liver. So expect people with thalassemia, they can have heart and liver problem because of iron deposition. Which organ is going to destroy those red blood cells? It's the spleen. So the spleen is going to be enlarged, which is called splenomegaly, because the spleen will keep destroying red blood cells, because, and when it enlarges, it can even make this anemia worse. So eventually people with thalassemia, they might have a surgery to remove the spleen, and the spleen also functions in helping the body to defend from infections. So when we remove the spleen, we might have infections. Another problem is bone deformities. Why is that? Because the body will start to try to decompensate and to make more red blood cells. So the bone marrow, which is located inside the bones, will start to enlarge and expand because it's trying to make more red blood cells. Also, you can have slowed growth rates. The last disorder that was explained is sickle cell anemia. Sickle cell anemia is when you have an abnormal hemoglobin, not deficient amount of hemoglobin, which is in thalassemia and iron deficiency anemia. No, you have hemoglobin, but the hemoglobin that you have is abnormal. Well, when red blood cells will start unloading oxygen, for example, when you're exercising or when you're stressed, this hemoglobin will change its shape. It will become sharp, and this will cause the red blood cell to be crescent in shape, like this. And the red blood cells will start damping up on one another and blocking the red blood cell, or clumping into a blood vessel, This will cause patients to start gasping for air and to feel pain. So usually sickle cell anemia happens in areas that are within the malarial belt of Africa. Malaria belt, it's like a belt on a map of Africa. It's a location, okay? And the gene that encodes for sickle cell anemia, what will do is the same cell that is affected by the parasite that causes malaria will cause it to stick to the capillary wall and to lose its potassium. Potassium is essential for the multiplication, replication, reproduction, I don't remember the exact word, of the parasite. So it will stop the reproduction of the parasite. Okay, so people with sickle cell anemia are also protected from malaria. If people have 2 genes are affected, they will have sickle cell anemia. If they have only 1 gene affected, they won't have sickle cell anemia. They're called to have sickle cell trait, but their children might have sickle cell anemia.